with Maritza Bond, the health director of the city of New Haven. First of all, it's so nice to see you back. You were in the studio 2 days before the world changed in 2020. We were talking about this new thing, COVID. You were trying to explain to us how serious it was. And then, boom, we were all
we had
remote,
to shut the city down.
And we did Zoom all the time. And now we're back in person with our fingers crossed.
Yes.
And with this new Delta variant. So we've got a lot to talk about COVID. But first, I want to say it's nice to have you back.
Thank you. And, it's my first, sit-down interview, not via Zoom. And so it's such a pleasure to be here. And I just want to thank you for your prayers while I was on leave. It just meant a lot. And I just want to thank a lot of the community leaders that also, sent messages or flowers. So I just want to make sure that I just thank all of the community for just reaching out. It just shows all of the love. I felt all of the love throughout the city for sure.
And, we always scream at each other in New Haven. We fight a lot, but there is a lot of love. The COVID pandemic proved it. I'm just looking at something new. But now we're in a new kind of interesting phase. There's this exhilaration in America, in New Haven. Mm-hmm. A lot of us have gotten vaccines. We're doing stuff we couldn't do for so long, being inside with each other, going to restaurants. I know restaurants seems to be such a big thing to people. I saved a lot of money not going to restaurants. But just hanging out, and we're back in our synagogues. And there's this Delta variant happening. Mm-hmm. So there's races going on. And in America, people like Maritza Bond are on the front lines trying to get people vaccinated. Mm-hmm. What's at stake?
So, at this juncture, we know that we have seen a number of variants within the world. It's a global issue. And one of the things that we are doing is consistently monitoring against these variants, against those that are vaccinated. And it's really nice to see that all the manufacturers of the vaccine, both Pfizer, Moderna, and Johnson & Johnson, have confirmed that fortunately for those that are vaccinated, there are currently protective factors against the variant.
Including the Delta variant, which is the fastest growing variant.
Absolutely. However, those that are still choosing not to get vaccinated are at higher risk. But what we do know about the Delta variant is that it is the highest transmitted infection in comparison to the other variants.
So it's the fastest spreading COVID variant to date.
Absolutely. And so we are now, on the ground, trying to ensure that we're doing a multi-pronged approach to providing education and also making accessibility in communities where we're still seeing significant gaps. And
so right now it's 61% of the city has gotten one dose. What I was reading this morning is 2 doses are more important than ever with the Delta variant. That goes up from 15 or 20% efficacy to 95.
Right.
And that 55% are fully vaccinated. Is that people over 12?
Exactly. It's people over 12. And when we look at some of the age demographics, I think some of the concerns that we're still seeing, and it also has to do likely with the way that things were rolled out, the latest age group that was rolled out was 12 to 15-year-olds. And so right now we're creating a momentum to try to focus on a youth vaccination campaign because that is the lowest age group currently vaccinated.
And we're talking to Health Director Maritza Bond of the City of New Haven on Dateline New Haven, WNHH-FM. Marissa, I'm going to ask you to get a little closer to the mic. Oh. So now who's not getting vaccinated?
So right now, one of the things that we're seeing is 12 to 15-year-olds. We're looking at neighborhood-based. And so when we're looking at some of the communities, we're still seeing West Rock, Amity, Amity. Is it Amity Road area?
Yep. And that's also called Beverly Hills, which I always thought was one of the great ironies of New Haven.
New Hallville and Edgewood. And so...
not the Hill, not Fairhaven. Well, Fairhaven did a great job, yeah.
We invested a lot of resources, not only as a city, but with all of our community partners.
Yep.
Griffin Hospital have been so instrumental. We have done over 220 pop-up vaccinations with recurring sites. So we go in and we continue to go to the same site just so that we can have a presence there until we achieve at least a second dose opportunity.
So West Hills, West Rock, Amity, Beverly Hills, Edgewood. These are your key places for people, and New Hallville. Now, you said 12 to 15-year-olds. Nationally, there's been this interesting conversation because most of the adults who didn't want it are harder to reach at this point. Mm-hmm. And a lot in New Haven, and I think everywhere else, these mass vaccination clinics have closed. So it's no longer you go to Wilbur Cross, you go to Hill House, Field House. Instead, you're trying to target the people that are reluctant. In addition to 12 to 15-year-olds, are you targeting the adults who haven't? And if so, how?
Absolutely. So we just received 2 different grants, a vaccine equity grant that consists of having community leaders that have grassroots experience and are influencers in the community. And we also received another grant from the Office of Minority Health to is called New Haven Heal, which we're getting ready to launch and officially announce. So you're the first to actually
Here we go, breaking
know.
news on Dateline New Haven.
And so that's going to allow us to develop a health literacy toolkit because a lot of the issues that we see, and we've tried to be very cognizant of this, is our risk communication efforts need to be in layman's terms. We need to be able to communicate at a level that is easily understood, giving everyone the right resources, and then also still providing vaccination sites that is going to not going to create a barrier. So we are still working with Griffin Hospital. We decided that although we are in COVID recovery phase, we are not going to stop vaccinating in the communities that need it most until we have reached herd immunity.
All right. And you also, first of all, those state grants, those two?
So one is a state grant and the other one is a federal grant from the Office of Minority Health, HHS, Health and Human Services.
So give me the pitch. All right. First of all, why are they reluctant? Why is it hard to reach this last group of adults? And why is it hard to reach the kids?
So this is, one of the things that we're starting to assess, and there's preliminary studies indicating there's a number of factors, and we're doing our own questionnaires as well to really ask why. And so there's some hesitancy around the fact that the side effects, people just do not want to deal with the side effects because it mimics having COVID for some people. The second reason that we were alarmed to learn is that many individuals, especially vulnerable communities, are not able to take time off from work. And so
President Biden has asked employers to give people time off.
Exactly. So we really need that momentum to happen. And so one of the things that we're talking about in the local level is really trying to ensure that employers are going to support their staff, because if they're coming in and they're not vaccinated, it just increases.
Well, what about employer mandates? Are you asking them to require their staff?
So we're not doing mandates at this juncture. We are, as a city as a whole, just requiring masks when you enter our city buildings, be out of the respect of the employees, especially those face-fronting departments that see a lot of customers, and you're not able to ask whether someone is vaccinated or not.
And 200 Orange is open now, right? As of today?
Yes.
All right. And so give me the pitch. First, pretend I'm my age, and I haven't gotten the vaccine. Health Director Bond, you tell me I need to get role playing now. Health Director Bond, you tell me I need to get this vaccine, but most people have gotten it, and I'm a little nervous about it. And I know my friend got sick. My friend was sick for 2 days. I mean, why should I get this vaccine? Why should I get this thing?
So it's important to consider getting vaccinated because the risk and the actual health outcomes of the vaccine are far worse. So you can actually have long-term effects that can hurt you longer term. We know many people, and there's still studies being done, that individuals have a hard time breathing or have a lingering cough for many months later. We also know that you can get COVID again. And so individuals that had COVID the first time, months later, they test positive again. And so the risk factors are still there. And what the vaccine does, it really is introduced into your body recognizes it, and then it fights against the infection. And so what we do know about the vaccine is that it's 95% effective. And so it's not 100% proof, but 95 is a great percentage. You have a 5% risk versus 100% risk.
So here I'm going to pretend I'm the person still. Someone called me selfish. They said that I should be doing this to help other people. I didn't quite understand that. If I think I've skated away so far, I'll be okay. Is there some reason that I should care about my loved ones or coworkers in terms of this vaccine?
That's something very personal to me that I share only when it's appropriate. But we know that in the beginning of this pandemic, we saw the most population that was vulnerable, and those were over 65. That had, higher fatalities. So
you're saying I can kill my grandmother if I don't get a vaccine?
Or someone that has an, immune compromise. And so if they're immunized, immune compromised, you can also put those individuals at risk, including children that are not still eligible to get vaccinated. So in order for us to be able to protect each other, the more individuals that are vaccinated, we can at least protect those individuals that have been mostly impacted.
So it's about protecting each other.
And it's really about also normalizing so that we can eradicate this disease.
Kurt Lang writes in, and thanks, Kurt, for coming in. Now writing in, big fan of Maritza. Appreciate your efforts to protect health and well-being of our neighbors throughout the pandemic, both as a mayor and as a citizen. Pleasure to meet you in person today. Thanks, Kurt Lang.
Likewise. Thank you.
You're listening to Dateline New Haven Health Director Maritza Bond. We're talking about that thing going around you might have heard about it, COVID-19. So, Maritza, you got a bunch of smaller events where people are all summer long, on the weekend on Long Wharf, Lighthouse Park every day during the season, Temple Street, I guess on the green, right, itself, 12 to 6 through the summer. We got lucky, and here I want to throw a bone to our station manager, Harry Droz, who's the resident Trump fan. We all hate Trump. But the truth is, Trump got us the best vaccines in the world. They work here. All the countries that got the Chinese vaccine, 50% of them got sick again. So we have these vaccines that work, and we want to convince people to take them. So one thing you're doing are these targeted smaller clinics where people are who haven't been getting the vaccine, and you're offering them incentives. You're offering them $10 Dunkin' Donuts cards, one place, Quasi amusement park tickets if they're at Lighthouse, which I thought was interesting. You're doing it at Lighthouse because those are the kind of people going to the beach, right? So I think I figured that one out. Other places just giving them $10. Does it work? If someone doesn't want to get the vaccine, have you seen it change anyone's mind? You talked about other things change their mind. Talk about them. Acknowledge the reality of their concerns and don't try to fool them. Tell them what information you have and what the value is. Does a quasi-amusement park ticket work? Does a $10 incentive work?
So when we're targeting different age groups and different populations, incentive is just a token of appreciation of taking that chance of taking the shot so that you can save another life, honestly. And so it's just a small gesture. And so we really target and change incentives based on where we are. So, Dunkin' Donuts and Quasi is just one example. Another example is this Saturday, and I'm going to do a pitch. We're going to be at the Forbes gas station. And
that's right. I heard about that. Yeah.
We're going to be giving out $10 worth of gas for anyone that comes to get their first dose of vaccine. Another campaign that we're getting ready to start is refer a friend. So if you're vaccinated, you have the opportunity to also be a peer-to-peer advocate because you're also vaccinated. So Paul, we need you to start advocating. I'm not going to name names, but there was one young person who's in our orbit who was not going to get vaccinated, not a staff member, concerned and talked about worried that if they had allergy to hair dye, would it? So they said no. And then we signed them to a story where other people were getting the vaccine, and because that person was there and saw other people getting it and not collapsing on the floor, actually got the vaccine. So It does seem like refer a friend and peer-to-peer is interesting. Yeah. And for us, we want to be able to, I think it takes, as you said earlier, it takes a community for us to get where we are. I don't want to brag, but New Haven did rock it. I mean, I am so proud of our community. We had the lowest positivity rate in comparison to other urban cities. We have the highest immunization rate in comparison
to cities, but not to the state. And why is that? Because the way socioeconomics work in America,
of course,
people in suburbs and who have more education and money get more vaccines.
Well, it's also some of the discrepancy, right? So while you bragged about Trump developing the vaccines and
I can't stand Trump. I'm just saying I have to acknowledge when he did something right.
We do have to acknowledge, but however, what he did create is a lot of mistrust and a lot of misinformation.
Just because he told people to march on a governor who was trying to save them from COVID and then shoot her. Yeah.
I'm going to remain bipartisan. But so when you have these individuals with the misinformation out there, and social media is like literally flooded with so much information that's not accurate, we are fighting against that. And so that is why now that I'm officially back, we're now sort of evaluating like what worked, what's worked, what has not worked, and what can we do different and
That's
unique.
So interesting because you're a lifelong public health person for decades. You kind of made your mark as health equity person, reaching communities that don't get as much health. You're going to get some lessons here. Do you have any interim conclusions yet about what worked over the past year and what didn't? Because you're also talking about testing, right? It's pretty similar, trying to get people tested, now trying to get them vaccinated.
Absolutely. And I think this needs to be there needs to be some lessons learned here. I mean, it is evident that we need to invest in public health, number one, because for decades, we were robbing Peter to pay Paul. I know it's such a lame idiom, but it's the truth. And so the public health system in general was dismantled. And so many public health officials like myself, thankfully I had a lot of support in my city, but other cities did not have that support necessarily. And so it really created disparities across the state on how we delivered our services and how we came together to ensure that those communities that have disproportionately been negatively impacted historically really was exacerbated during the pandemic. This is going to be a time for us as healthcare, all the different systems and all the sectors to really evaluate what are we doing? Because when we do not invest into these communities, it ultimately impacts us. And it is from an economic perspective, if you want to really look at it from that angle.
And then, so anything specific you saw when you look back at the last year, 15 months, this worked, this didn't?
One of the things that, I felt like overall a lot of things worked. Communities coming together, different sectors coming together. I think what obviously didn't work is just the delay in getting things activated. So for me, our response efforts were timely because a life mattered. And at that point, I felt like our country was not ready for a emergency such as this one. So we really need to look at what we were able to accomplish but what we could have done better, quicker, if we would have been prepared. So
we're talking with Health Director Maritza, who's sort of like the superstar of public health.
Thank you.
From New Haven on WNHH's Dateline New Haven. But you're only as good as what you did yesterday, and you're coming up with a new challenging period in which we feel like I'm going to talk about myself as a human being. Like I was on the more nervous end of COVID. I did all the restrictions. I followed everything CDC said. The only person I went inside with for a year and a half was my wife and my daughter's family. And now that I've gotten the vaccines, I'm believing the CDC that I'm not risking other people or myself. So I'm going everywhere. Mm-hmm. But, that might not turn out to be true. We have this period now where we have to have two ideas in our head that seems opposite. We can do stuff again. We can go out and around if we're vaccinated. And we don't know everything about this Delta variant, which is the fastest growing variant in the state and country. And in fact, we learn new things every day. Just this morning, we learned that if you've had COVID, but you haven't been getting 2 doses of the vaccine, you're not protected against the Delta variant. So is it true? Am I right? I don't really need a mask, that it's just performative. Like I do care about wearing it to make other people feel safe. So if I'm 200 orange and they can't tell who's vaccinated, I want to have it on to be respectful. Mm-hmm. But am I right that I'm safe? Going back to synagogue, going back to...
You're not completely safe, right? So
but in life, we're never completely safe. So I always feel like I'm more at risk riding my bike at Whaley Avenue, but that is no different from the flu or what?
Absolutely. So I think first and foremost, what we need to be mindful is that we do not know who's vaccinated, right? So right back to your first point is we do not know, or nor can we trust other people.
But am I in danger if I'm around someone who's not vaccinated?
As long as you're not the only person vaccinated in the room, right? So if you're in a room and there's 100 people and you're the only one vaccinated and there's no ventilation, you're increasing your risk.
But if I'm in a place where most people are vaccinated,
you're safe.
Even if I go to Cafe 9, I'm okay?
Yeah, you're definitely safe. And I think one of the things that I try to do, and I just did it, I read this article, I'm always on Twitter, and I just followed your station right before I logged on. Having your mask on your wrist lets people know that you are not against mask use, but you will have the courtesy to put it on so that you can protect those that need to be protected. Because we need to think about children, right? They're not protected right now under the age of 12. Hopefully in the fall, we'll see a vaccination for them. Right now, we still are seeing a slow rate of 12 to 15-year-olds getting vaccinated. So we need to make sure that we're amongst those youth that we are really being mindful of their risk factor.
Okay. Maritza, talking about Delta variant. Now, what about how variants develop? And you're so much more knowledgeable about this than I am. Let me give you my layman's impression because I read about this obsessively. My understanding is that something like COVID keeps evolving to try to beat the defenses we put up.
That's right. It's called mutation.
But that at some point, as with the flu and other viruses, it stops evolving so fast. So it's still evolving fast. The Delta variant evolved fast. It goes 6 times, I believe, as quickly spread as some of the early variants. Apparently it gets to a point where if enough people are vaccinated, it slows down, so every variant is less dangerous. Is that true?
Absolutely. So when you look at the history of diseases, right? And our public health milestones that we were able to eradicate smallpox. We have vaccines against the measles and the mumps, etc. We know that when a large number of the population gets vaccinated, we build herd immunity, which is a protective factor. And so that is why it's so critical. And so we have to do a better job. And we say this all the time. And that's why we're developing and partnering with different groups so that we can ensure that education and getting the right information to individuals' hands so that at the end of the day, people can make the right decisions.
But is herd immunity a realistic goal?
Yes. I mean, we're close to it. We're at 55%.
And can't we add to that people who have had it? I guess not now with the Delta variant, because if you had it, that's not good enough.
Absolutely not.
Because it used to be you add the two, because some people in Wall Street Journal, some public health experts proclaimed it over in March, saying all you got to do is add vaccinated and people who have had it. But I guess that's not true.
That's not true. Absolutely
but
not.
You think we can get to 70?
Absolutely. I am very optimistic, as you know. If there's a will, there is a way. And I will be in your neighborhood knocking on your doors because I'm officially back. And so everyone, I think, knows by now that I don't shuffle papers at my desk. I'm all about like really going into the communities and engaging into tough conversations. And you know what? They are tough conversations, but I'd rather have a conversation and allow someone to ponder upon what was said and then allow them to also know where we are going to be so that they can be able to make a decision. Tamar,
I'm sorry, I don't know how to pronounce it. Collins writes in, and thank you for listening, Ms. Collins. She asks you, Director Bond, should CT Transit have a window open, even if the air is on? Or is there sufficient air filtration being used? That's a good question. I was on the bus for the first time, and I realized I needed the mask, and I wondered, am I putting myself at risk being on the bus?
So, I definitely still think that there should be some social distancing in the buses, for sure. The ventilation system is just like a car ventilation system. So, if they want to have a window cracked open for safety measures, that is that is what Connecticut Transit wants to do. And so I'm not against it. I get it that the AC is on and it's probably 90 degrees and there's humidity. But, if you're following the proper measures, you have a mask on, and you have the social distancing, your risk is really low.
But you can't always social distance on the bus. It gets kind of crowded at times.
Yeah. And so, that's something that, Connecticut Transit needs to continuously. Don't make me have to call them.
Okay. You don't have to call them. But so you're telling Tara are you telling her to crack open the window when she's on the bus?
She doesn't have to crack open the window at all. The ventilation system, it should be fine. But if the windows are open for whatever reason, the AC may not be working. That is also another option.
Because I did stay off the bus because I was influenced by an early report out of China that showed the fastest spread early on was people sitting on a bus with windows closed.
Really?
And they showed that they traced some of the early outbreak to people who had been on one bus ride where the windows were closed and everyone sat together. And they had a control group where the windows were open and nobody got sick.
So we've been very fortunate in the city of New Haven where none of our outbreaks resulted from being on the city bus. Most of our outbreaks resulted from...
Remember Detroit, how sad that was?
Yeah, that was actually sad. But most of our outbreaks resulted from restaurants, faith-based organizations, and parties, like gatherings either illegal parties or private homes. And so, and also like the college parties when we went back on campus.
But we're okay to have parties again.
Well, you want to be mindful of who you're inviting to your party.
But if most people are vaccinated, you're
okay? Good.
Like absolutely. Last night, a friend of mine had a mother die, and so we have 30 of us in a room saying the prayer for the dead. And I realized we were all pretty close. I know that just about everyone was vaccinated, but I was realizing we didn't feel comfortable doing that before.
Yeah, no. And, so in my church, we're still sort of having some distancing because, it's still a comfort level, right? And so we're just getting acclimated to this new normal again, because for 16 months, we were masked up for the most part. And even myself, I have a little bit of OCD that has resulted from this.
Yeah. I know it's hard to change. And Tara says hard to social distance. A lot of people are on the bus. Amen to that, Tara.
Yeah.
So where do we go next? Do you think with the Delta variant and increased cases, do you think we're going to go back, A, to having to wear masks more often? Or B, do you see us being shut down again?
So, we're very fortunate here in Connecticut. We are definitely closely watching the variants. And also, if we see any clusters of cases, we'll be partnering immediately with the state. Right now, we are less than 1% positivity rate in the city of New Haven. And statewide, we are not seeing, we did see a slight increase in the variant, and we are watching it. but there's nothing to be concerned of
Do you
as of yet.
Do you predict in the fall we'll be staying home again or no?
No.
You know, that's
not
good
at
to
this
hear.
juncture. As long as we continue to strive on getting vaccinated.
And you know, I wanted to ask you about that. What about? I mean, there is Alabama, there is Mississippi, where people are just not going to get herd immunity, and people travel to India, and sometimes they take a plane from somewhere else first. Even if we hit herd immunity, is that going to be good enough? And is it city herd immunity or state herd immunity?
So yeah, like yesterday, I was reporting like what our city herd immunity will look like versus our statewide immunity, and so those are things that we have to consider. Many countries are not letting us in, or vice versa, because of the pandemic that's happening still in so many different countries. And I think what's makes me really sad is that here in the United States, we have an abundance of vaccines where in other countries, people are begging for those vaccines.
I know, that's one of the saddest things.
That breaks my heart.
I think about the favelas in Brazil or India and the slums, and here people, we have them and we're begging them to take it.
We are spoiled and we have such a luxury and we do not realize it. And I think in regards to those that are not vaccinated, I just want to encourage those that are not vaccinated to really have an honor system and respect the fact that you made that choice and wear a mask at all times, because we want to make sure that as an unvaccinated individual, they're not exposing other people.
All right. Well, Maritza Bond, thanks for still being on the case.
Oh, thank you.
We got you in this next phase, and I hope that we can continue to gather in person so we can have you back. And here's
Absolutely.
a wild idea. We'll talk about something in addition to COVID, like lead paint and some of the other work.
Oh,
you're
yeah,
doing.
absolutely.
So we got a deal.
Absolutely.
All right.
Thank you. It's been a pleasure.
It's always a pleasure to have Maritza Bond, Health Director of the City of New Haven. Thanks for joining us today on WNHH-FM, 103.5 FM. And we're going to take it out with the Afro-Semitic Experience performing I Wish I Knew How It Would Feel to Be Free.
Oh, nice.
From the group CD, A Plea for Peace.
Are we disinfecting stuff? I hope. In between users?
Well, actually... Oh, that's right, because of breathing. Because the hand sanitizer is actually bad, right? Because that builds
but
us
like the aerosol.
Super bugs. Yeah, okay, that's a good point. Thanks for that advice. Good thing we had you
welcome.
in. And we're going to take it out with the Afro-Semitic Experience performing I Wish I Knew How It'd Feel to Be
Especially
Free.
the mics.
From their CD, A Plea for Peace. This is Paul Bass inviting you to fly free with us all day and all night long. WNHH, New Haven's home for community radio.